I'm starting the recording now that we're at our official start time. And I'm going to have us do like a quick little icebreaker, kind of going along with the line of what we've already been talking about. With the month of love, I was just thinking that we could all drop in something, just our name, hub, or organization, and something that you are loving or really enjoying. It could be food, dessert, a show, a book, anything like that. So I will put that in the chat, and I would love to see, just even for my own selfish reasons, to get recommendations of what everybody's reading, watching, eating, anything like that. So I can go first. I will go ahead and say it again. Maria Mendoza, Hub Coordinator. And something that I'm loving right now, I've gotten really into, again, the Libby app, of course, through the library. I always say I'm going to read and I want to actually read physical books and all of that, but the Libby app just makes it so, so easy. And I love it so, so much. And for food, again, going back, my husband and I have gone way more often than I would like to admit. There is a Saudi restaurant in Portland, Oregon that opened up a couple months ago, Queen Mama PDX, and I really, really enjoy their food, and they have really good desserts as well. They have a pistachio cheesecake that is dangerously good. So anyone ever wants to check it out, it's really home style cooking and it's super, super yummy. But really excited to see what you guys drop in the chat. Let's see, Begonia, Washington County. I love Hawaiian outriggers, so I love that I will paddle tonight after a month of inactivity. Renee, loving some sunshine today. I'm with you, Renee. Some sunshine is feeling really, really good. Rod, I really love it's going quick. The day of fake spring in Wallowa County yesterday. I know the fake spring is getting me as well. Norma, I am loving my new puppy. Yes, so Norma got a new puppy. Maybe if we get lucky, the puppy will make an appearance at some point on
I think
screen.
so.
Yeah. Molly, loving knitting baby clothes for friends. Oh, that's so special. Meg Ryan, I am reading the Practical Magic novels and love them. Also love the library. Yes, good. Middle East flavors at Karam. Oh, okay. Thank you, Begonia. Jen, I love anticipating my friends' visit this weekend to go to the symphony with me. Yes, that's a great one. Margie, I love the longer days. I'm with you, Margie. Shira, Four Rivers. Okay. I am loving doing paint by numbers. I love paint by numbers too. That's a good one. Donna. I am learning how to weave. I love this. Christy Collins. I love it finally still being light when I get home from work. Yes, that's everything. Patty, I had daffodils coming up in my yard this weekend. Hello, sun. Carrie, love planning for gardening season. Abby, I love time away to reset. Shout out to neighboring Yamhill County. We visited Carlton for the weekend escape and enjoyed a cool farm to table experience with dinner from Humble Spirit while staying at Tabula Rasa Farms. I hope I said that correctly. Jillian, let's see, loving reading the articles my daughter sends me. Also looking forward to visiting her in March. She keeps sending me amazing menus from restaurants in Placerville, California. That's so wonderful. The Carlton Winemaker Studio is great too. Wonderful. Thank you guys so much for indulging me and just sharing what you guys are loving at the moment. Do have a pretty packed agenda, so I will go ahead and get us started. We are going to get started with Carrie. So we have Carrie Wells here from 211, and I will pass it to Carrie.
Hi, thank you for having me today. I know I've met some of you and presented recently to some of you, so I apologize if this is duplicate information to what we've talked about before, but we thought it'd be good to just present to everyone as a group and do updates once in a while about 211 here as well. I'm going to share my screen. I have a short presentation. Okay. always the hardest part for me is getting my presentation up. Okay, can you all see my slideshow?
Yes.
Okay, perfect. All right, so I think most of you are already familiar with 211 info, so I'll do just a very, very quick overview about what we are, and then we can go into more detail about the child care team. This is my contact information. Feel free to reach out directly to me if you'd like a presentation or someone to visit your area to table at an event or meet with families or providers. We're always happy to come visit you in your communities. And for those of you who aren't as familiar with 211 info, 211 is a phone number, easily recognized number that is recognized across the nation as the number to call for social service referrals, state agencies, community-based organizations, things like that. So similar to 311 or 411, we are designated by the FCC as the number to call nationwide for information and referrals to social services. A couple things that have changed over the years with us is that we used to be about like 50 staff members at 211, and we were all kind of located more so in the Portland metro area because our office and call center were located there. After the pandemic, our workforce increased, and we actually now are funded to have around 150 people who do, and that's all of our staff. So that's people taking childcare calls, people taking general 211 calls, people doing outreach, HR, you know, our whole organization. So we've got about 150 people, and a lot of folks are actually dispersed throughout the state now. Many of us work from home or hybrid. Sometimes we go into the office too, but we're all over the state now, which is really great because that was one thing that we heard from a lot of people was kind of missing from our services, is that we didn't have people statewide. We have community engagement specialists who are housed, live and work in their local regions throughout the state as well. And so if you ever have a meeting or an event that you want someone to attend, please reach out to me and I can get you in contact with your local community engagement specialist if you're not already aware of who they are. And they can deliver materials to you, things like that too. So at 211, we hire bilingual staff. We also have some staff that aren't bilingual, but we really try to hire folks that speak multiple languages who are answering the phones. And then when we are not able to have someone answer the phone in someone's primary language, we also can reach out to a language line. We currently actually work with 3 different language lines just to make sure that we have all the languages covered that we get calls in Oregon. And then this is our coverage map. So 211 covers all of Oregon and then 4 counties in Southwest Washington. And that's for our social services referrals. Specific to childcare, we only serve all of Oregon. If somebody calls for childcare in one of the counties outside of Oregon, we generally can either provide childcare referrals in Oregon if that's what they're looking for, or we can refer them on to their local childcare resource and referral in their state. So a lot of time, like we get calls in Eastern Oregon for Idaho, or we get Washington calls too sometimes. And then for the child care line, I know you're all aware of us already, but we work in a partnership with Oregon's Department of Early Learning and Care. We also partner with Oregon Department of Human Services, and then with the local child care resource and referrals. So as you know, DELC is our funder. And then Oregon Department of Human Services refers like a ton of families that they're working with to us to either speak with them about employment-related daycare or to refer providers that are listed to receive ERDC. And then they also refer families to us often who aren't eligible for ERDC. And now that there's a wait list for ERDC, they're also referring a lot of families to us to try to find
additional resources for either help with the cost of childcare or help with other needs that families have. And then the local childcare resource and referrals are, they partner with us in the aspect that they are adding and updating the provider information that goes into Find Childcare Oregon. So at 211, we use the 211 database to find social service referrals, things like rent assistance, utility assistance, things like that. And then we utilize the Find Childcare Oregon database to make the childcare referrals. So we're just working in that same database that the local CCR&Rs are using as well. Our referrals are confidential, but we do ask for quite a bit of information from a family when we make childcare referrals. We base the referral on the location that they want to search for childcare near. So that would be like home, school, work, things like that, wherever the parent wants to search from. And then the hours that they need care, days of the week, ages served, languages that they want the provider to speak, things like that. And then we really try to get the family list of providers that are a good fit for their needs. We don't guarantee vacancies. The vacancy information can change often. And so that's one thing that I hear a lot is that people think that we're guaranteeing that a provider has a vacancy, but we really can't guarantee that part of things. And then we provide referrals over the phone, through email, or through text message. Sometimes we also mail the referrals in the mail to families if they don't have another way to get those referrals. And then all of our resources, our referrals for childcare come with information about how to find quality childcare. It comes with a nice checklist that helps families think about what would be a good fit for their family and help them to try to kind of think through the process of what is important to them when doing their childcare search. And then our hours are Monday through Friday from 7 o'clock in the morning until 11 at night. And then we're also open on Saturdays and Sundays from 8 a.m. until 8 p.m. So we get a lot of calls from families that are kind of maybe on their lunch break at work. Sometimes they text us when they're, taking a break, after they put the kids to bed at night, things like that. So we're definitely open quite a few hours that make it easier for families to get a hold of us. And then I pulled a little bit of data that I thought might be helpful for you all to see. So last year, from January 2023 through December 2023, at 211 Info, overall, we had 373,000 contacts. So that would include web searches, phone calls, text messages, and emails. And that's to our general 211 line. So overall, all of 211, that's what we had. Specifically to the childcare line, we had 5,865 contacts directly, and that doesn't include web searches for childcare, because the web searches for childcare come through Find Childcare Oregon, not through the 211 system directly. And so I just got some data from TRI. They're the ones who actually manage the Find Childcare Oregon website. And they shared this number of 85,000, a little over 85,000 web searches for childcare. And so that is people who went onto the Find Childcare Oregon website and clicked find, like they were trying to find results for childcare searches. So it's a really big number of folks that are looking online for childcare. And then we collect a lot of information at 211 when we are providing referrals, just because we share a lot of the data with our funders, with community partners who request information about what we're hearing in different communities. And so this information I'm sharing with you all is all statewide information. But if you're ever interested in finding specific data that we have just for your area, I'm happy to share that with you. We can pull it via zip code or county, region, things like that. So at 211, we collect the community needs information, and statewide, this is in order of needs that we are seeing from basically every county statewide has very similar information coming up, but housing and rent assistance are the top need that we hear at 211. Utility assistance, food, healthcare, legal and public safety information, and then individual and family needs. So those are the top things that we hear from families and individuals statewide as needs. On the childcare line specifically, some of the common requests that we are hearing specific to childcare is families are looking for before and after school care with transportation. Infant care and preschool are generally the top requested age groups for childcare. Extended hour care, evening and weekend care are often requested. Help with paying for cost of childcare is one of the top calls that we get. When we get those calls, we refer to things like ERDC, Preschool Promise, Baby Promise, Head Start, basically any program that provides free or subsidized care. And then also we have listings of childcare providers that might have scholarship programs, sibling discounts, things like that. ERDC approved childcare is a top need. Requests for multiple lists because families are reaching out to a lot of programs and hearing that they're full or they're getting onto wait lists. We receive a lot of questions about ERDC, just kind of like, how do I apply? Specific information asking about like which programs would take ERDC, whether or not their income is eligible, things like that. We get a lot of calls from providers who are calling to update their information with us, and we don't update provider information in Find Childcare Oregon at this point. That is done by the local childcare resource and referral agencies. So whenever we get those calls, we then refer them over to their local childcare resource and referral to get their information updated. And then sometimes we hear from families that try to use the online Find Childcare Oregon search on their own to find childcare, and they struggle sometimes with the search. And so then they reach out to us and we are able to just get them a list when they're struggling with that online search tool. And then I mentioned earlier, we do have community engagement specialists statewide. And then I also love to travel around to different regions and meet with you all and provide presentations or table at events. So please feel free to reach out to us if you ever want a presentation or someone to attend an event. And we invite you to also follow us on social media. We have a lot of information about different events in different areas on our Facebook page. And if you ever want us to share information about an event in your area, you can send it to me and we can work on getting it put onto our social media page as well. That's kind of all that I have. Are there any questions or things that you'd like to talk to us about that I didn't touch on here today?
Great. Thank you so much, Carrie. If questions do come up, feel free to email me, or I know in my recap email. Oh, I see Michelle has a hand up. Yes, go ahead, Michelle.
Hey, hi. I just was curious. I know Molly put in the chat that 211 has been helpful with promoting the preschool marketplace website, and I just was curious from Carrie or from Molly what that means or what that looks like.
We put the preschool marketplace website in the 211 database, the social service referral database. So when the public goes onto the 211 website, 211 has their own website, and then there's also a Find Childcare Oregon website. But the 211 website has social services in it. And so that website that Molly's mentioning is actually listed in the 211 database, and so people can find it online that way. And then Molly has invited us to attend some of their meetings where partners are getting together to kind of plan for different events around the preschool marketplace. And so we've attended a lot of the events with them and tabled at the events, things like that. I don't know if Molly has more details to
That's
share.
exactly right. The preschool marketplace is just our Multnomah County Google search for all publicly funded pre-K. So your family can put an address in there and then find Head Start or Preschool for All or Preschool Promise or whatever's available. And Carrie's been really helpful in those meetings with partners at building collaboration and just being kind of an outside entity too, whose job is to figure out how do people coordinate and create access points for parents. So I really appreciate the way you come into a meeting, Carrie, with that ability to just say, how do we make this work for families? And not, you voice 211's ability, but you're really thinking about access in all of its broad ways. So I'm really grateful for that.
It's been really nice. It's been fun working together on that project.
Shira, I see you have your hand up as well. Go ahead.
Hi, thank you. Hi, Carrie. It's nice to see you again. I think that I've asked you this before, and I was just wondering if there's any updates on it. It seems like in our area, which we're much less populated than Molly's area and many of the other areas represented here, but many of our partners and our families do not know about the Find Childcare Oregon website. And I'm wondering, like, is there some plans for a campaign to advertise that and to share that? There's, and I think that we've discussed this before, there's a bit of a hiccup where families, they want to speak to somebody, they want to speak to somebody local. They really want to speak to somebody they know. But and I know that we could help with that, and we do, and we share that information. But it seemed like when our child care resource and referral brought up the FCCO website, that many of our partners were not familiar with that. And just kind of wondering what kind of marketing can happen to help people become more familiar so they could use it better more.
We're happy to like table at events and get our materials out more in the community. A lot of people are confused about the difference between 211 and Find Childcare Oregon. And so sometimes people call Find Childcare Oregon 211 or the opposite. There is some confusion about that. So we're always happy to attend some events if you know of some partners that really need to learn a little bit more about what 211 does. I might let somebody from DELC take on the part about Find Childcare Oregon, though, because I'm not sure what the plans are for that.
Maria, do you want me to take that?
That'd be great, Margie. Thank you.
Okay, it actually segues into our next presentation, but so I just want to double check before we talk about marketing Find Childcare Oregon, if there are any other questions for Carrie. Okay, so I don't know if I waited 10 seconds, but I think it felt like 20. So go ahead and go. And Carrie, thanks. It's always so fun to listen to your presentations and all the great work that you're doing. And as Carrie was saying, and I know this has been something that's been a little confusing for a lot of people, is 211 has a database they reach into for community services. And she shared there were hundreds of thousands of calls for that. They also reach into another database. It's a different database. It's Find Childcare Oregon, and it's administered by the Research Institute at Western Oregon University. And Find Childcare Oregon is only for early learning and care programs. It's only for our childcare provider information, and it is specifically about finding childcare. So it is a different database administered by the Research Institute at Western Oregon University through our contract with them for central coordination for CCR&Rs. That database holds childcare information. And really kind of the marketing for that is, and I appreciate that you brought that up, Shira, because it is probably a little different in different regions. But it could be also kind of a statewide effort to really get that information out. And I think hearing that there's some gaps, this is a good reminder that we're probably ready to do a push out again and work with central coordination and our CCR&Rs to really get that word out. Find Childcare Oregon also holds the parent information. So when Carrie's team gets a call from a parent, they enter that information in order to do the sort and the search for childcare that best meets the needs of those parents. So and then that's all confidential. We don't share disaggregated information or data about parents. However, we are able to capture the information on childcare and data around that. So I also do know that in some regions, it is different as far as the community partners not really knowing what it is, and some really do and utilize it in a variety of ways. The other people who reach in to Find Childcare Oregon, as you all know, are our CCR&Rs, and they are responsible for updating the childcare provider information. So the vacancies, any changes that they may have in their programs, bringing in new programs, so entering new information about new licensed childcare programs. And the other thing that's really important to know is it's voluntary. Providers are not mandated to go into this database. However, there are so many benefits for them being in it that it's strongly encouraged. And it is used. I think we might have around 95%, and I'm not sure if that's accurate, but we might have about 95% of our licensed and license exempt programs in it. With that, I would like to turn it over to Hannah Annenson, who is our Central Coordination Director at Western Oregon University. And Hannah pretty much runs this database by, just her with her eyes closed. And she's going to talk a little bit about it, but she's also going to talk about a new feature that we have. It's the Child Care Safety Portal that will be accessible for parents and providers, actually for anybody. And we already have it on the DELC website, but it's not very user-friendly. It's hard to get to. You have to click several times. But our DELC IT team has been working on getting it so it's more user-friendly. And we can get information about providers' compliance history. And it's very easily accessible inside of a referral. So parents can have it right away. So with that, Hannah, do you want to go into a few more details and maybe share some of the beautiful demo that you have?
Yes. So hello, everyone. Thank you for letting me come. Sorry, I got my child's head cold. So I am here to talk about the Find Childcare Oregon search. So I felt like it was very segue when Carrie was talking, just to kind of go into the next agenda item. So I appreciate your guys' time today. For those of you that I don't know or haven't seen, my name is Hannah Annenson, and I support Childcare Resource and Referral Central Coordination at Western, as Margie said. And we have been working for the last almost year with DELC and their team to integrate the Child Care Safety Portal into Find Childcare Oregon. So now when a family or individual is searching for childcare options, they will also be prompted to look at complaint and compliance history of that childcare facility or anyone that has a childcare license or record within the Department of Early Learning and Care. So if it's a potential recorded program, there might be information, or a regulated subsidy provider, there may be information as well, indicating how DELC has interacted with that program. And we are soft launching on Friday. So and we found this out last week, Friday. So this is hot off the press. We have been previously working on getting communication out to our partners, and you guys are a part of that. And so we're really here just to show you what that's going to look like and let you know that it's happening. And you'll see emails and other communication coming from DELC around how this may affect how you guys operate. But really, this is just in my opinion, is new, but it's more of transitioning of information. So we're putting it in one place so that those that are seeking care don't have to go and call a phone number or reach out to a different website to find information about complaint and compliance history for childcare programs. So with that, I did put the Find Childcare Oregon website in the chat. As of Friday, it will be updated with the new portal links, as well as Zelk's website will be updated with new portal links. It'll all funnel through Find Childcare Oregon. And also a new update is Find Childcare Oregon will no longer have an ability to create an account. It'll all be open source completely. So there's going to be no guest login. Or just continue without creating an account. We do have some people that do create accounts because they like to save information of programs, but because of the inclusion of the portal, it's just an open source search now. So there'll be no login or information in order to get to a childcare referral search. And we're really excited about that. So I'm just going to take a minute and share my screen with you. Okay, make sure the right one. And please at any point stop and ask questions, because this is something that we live and breathe every day. And I could skip over a detail that would be supportive for your knowledge base or those that you work with. So please stop me at any point, put in the chat, and I would love to address questions as they come up. So currently, this is the current safety portal. So how many of you, I'm assuming most of you know about it and have accessed it before. But this is the current safety portal. And now it is going to look something like this. So it is going to be a function of search compliance reports within Find Childcare Oregon. So when people link to it from Department of Early Learning and Care or other websites, it will go directly to this search page and allow people to search complaint and compliance history of programs. From there, they can get definitions, understand that they need to contact Child Care Licensing Division for any additional information. It is only reporting up to 5 years. So there may be information on programs that happened 15 years ago, and it might be counted in a tracker or a number, but it's only visibly showing 5 years of data. So if you're ever out there working with anybody, it's really important to let them know that it is only 5 years of facility information. And so it is important to call. And so just everything is going to be here. So what happens is I'm just going to pick a very common quick find name. The other thing about this system that's different from the current portal is the current portal doesn't allow you to search active or close. It doesn't allow you to search by license number. It's only really by kind of facility name, and that's if you know the specific name. And so there were some challenges with that. So now you can do a quick find search that's going to pull up anything with happy in it. You can do it by a location, a zip code, city, or regulation type. So I'm just going to put happy and I'm going to do a center. And then I want to find an active program. So they don't have a closed license. From there, it would pull up any program that has happy in the name somewhere. So actually might be a few programs, but we'll just wait for it to load for a second. Oh, only 7. That's not so bad. So as you can see, it's pulling up Happy Day, Happy Valley, Happy Hollow, so different programs across the state depending upon what it is. It'll show the licensing information, and then it will also go in and show the complete compliance history of the program. So the inspections, as well as defining what it is, the complaints of the program, which are now divided out in the current portal. They're not divided out, so people can go in specifically and just get complaint information, as well as it identifies serious injury reports and highlights those that are reflected in the definition shown. So it's going to give people that information. And this also will be linked on the search for programs. So this safety and compliance report button, if this program shows up on a referral as an option that meets the individual's needs, it will have this button and they can click and look at that complaint and compliance history in real time as they're looking at other information about the program. So the request for compliance history section will disappear, but how to make a complaint will remain and where to do it. Begonia, can you restate your question. I'm unclear of what you're asking.
I'm on the web. I'm on the DELC website. So in the website, you have two sections. One is how to report, how to make a complaint, and the other one is for families to request the compliance history. Is that section gonna be disappearing and be replaced by this one? But still, do they have to go through the same channel to make a complaint?
My understanding is complaints for childcare goes through the same channel of childcare
Okay,
licensing
same
division.
channel. Okay, got it.
Yep. Everything stays the same. I mean, we're basically just taking the data in from Department of Early Learning Care every day actually, but they own it, which is why it's branded for them. It's just a part of the component of the system now, but we do nothing with any of their internal processes. We're just showing the information for them. And then Rob asked the question of, is there a reason why registered preschool is not listed? It's because this is specific information listed within Department of Early Learning and Care. So registered preschool is not an option for a type of regulation. And so it's based off of regulation status of licensing. So, however, if you're searching for a program on the referral side, you would be able to potentially search on different program types. So an example would be, let's say, Preschool Promise or Baby Promise, different program types. And then if a program is identified as that, it would show up and their compliance history would be in there. So let's just say I'm going to search Preschool Promise. Maybe not. And this is also the dev site, so it might not be linked right now. I don't think it is, because it's not live yet. So if it was to work, it would go Preschool Promise, find, it would show up every Preschool Promise program we had, and that complaint and compliance history, if they are licensed and have a regulation within DELC, would have this button showing that information. Does that answer your question, Rob?
Yes, it does. Sorry.
No problem.
And just keep in mind, it's not live until Friday. So if you try and do this now, you won't find the safety licensing and complaint report on each one. It won't happen. Okay.
Yep. So, which is why I'm in here right now on a testing site. So, so we just wanted to make sure that you all were aware as you support some components of early learning and also work with families and kind of to the request about information about Find Childcare Oregon. And so this will be linked within DELC's websites. It will make it a lot easier for those to access the information. And so we just really wanted to make sure it was in your eyesight, and that if you had any questions or things that would be helpful as a resource. I know that we're currently working diligently on getting talking points for CCR&Rs as they work with providers about it. The other thing to know is the union has been involved in this the whole time. They also have seen it and signed off on it. And so it's not that this has happened behind closed doors. This has been in great partnership with DELC, the unions, CCR&Rs, and my team. And so now it's just time to get it out there, and we hope people use it well, and I'm sure we will enhance it and adjust as time goes on. But it's really meant to be the place for that one-stop communication around that piece of childcare.
Thank you, Hannah. I think another important thing to remember is that with referrals, and it doesn't matter what kind of referral it is, whether it's through coordinated enrollment for a DELC-funded program or a referral that's coming from a parent calling 211, that we do referrals and not recommendations. If there has been precedent set that if it looks like a recommendation, like this is the program you should go to, coming from the referring agent, it has happened that if abuse happens in that program and the parent decides to sue, the referring partner or agency could be liable. So that's why we're always really careful to provide referrals, which means more than one program and information on quality. And so you'll find in the Find Childcare Oregon website that there is a whole quality guide, what quality indicators look like. And this information on compliance is an additional part of the education for parents, so they can be very clearly informed in parental choice. So those are just some important things to remember. One of the things we do know is, it's chances are parents are going to be asking you about this. So as Hannah was saying, we want to have some talking points that are showing the whys, why it's supportive for parents. And so everybody will have that backup and be able to share that if needed. Begonia?
Yeah, so at this point, hubs are not aware when a childcare provider is under investigation because that is confidential information. And according to the Preschool Promise Manual, we still have to be enrolling children regardless of the unknown situation, and there could be a funding. Does that thing mean that we are liable also for something that we cannot control?
No. What I was trying to share is that it's the way that you are providing the information to the parents so that they're in choice. So it's not like you would take that parent and say, go here, right? When you're doing coordinated enrollment, you would say, here's a choice of DELC funded programs. So you're still doing the choice. That's the important piece of it. And as far as that, CCR&Rs don't know either when a program is under investigation. And so that is something that I know is always an important piece that, we have to really watch and be careful about. But this safety portal is going to give information much quicker once the investigation's over. So did that answer your question, Begonia?
Still doesn't. It feels like a big gray area. So because we are not gonna tell families where they gotta go, but we are actually supporting them in the enrollment process, and they are filling out one of our applications in our portal with our team. And so if something happens and there is like fundings and something happened to a child, again, who is liable for that piece when we are not aware of those pieces of information, but we still have to go through?
Yeah, you would not be liable. And we can talk offline more about that. It comes from some historical information and precedent that's been set throughout the nation. But coordinated enrollment would not create a liability unless you chose it for them, which I doubt, which does not happen. So.
I just wanted to kind of tag on to that. So we have such limited preschool promise sites, and typically when a family applies, they're going to go with the one that is in their area that they could get to. So it's not like we, say like, here's 4 options that you're eligible for. Like, we tell them you're eligible for preschool promise, but that liability piece certainly does raise my alerts, and just wondering if that's a discussion that maybe we should also have offline with maybe some of my staff to make sure that we are using correct verbiage to keep everybody safe.
Yes, I think it would be really wise if we across the state were able to kind of really have clear guidelines and parameters of what it looks like to provide referrals and support parental choice. And I do know in the very rural regions, and not just rural, I know in some other areas as well, that there's very limited choice in what they qualify for. So how do we ensure that they're getting the guidance on what quality looks like, parental rights, provider rights, all of those different things? And Hannah, I know you have to go, don't you? So thank you. I'll try and answer any questions you may have for Hannah, but thanks so much. That was such a great demonstration. Really appreciate it.
Thank you. And my email's in the chat. If anyone has any questions or wants any additional resources, please don't hesitate to reach out. Thank you all.
Right. And so CCR&Rs have those who have done referrals in the past really understand this. Renee, I'm looking at you. They really understand this process. I think it might be an opportunity at perhaps a learning collaborative where we're all together and we could do kind of a deep dive into that. Or I would be happy, along with Carrie and Hannah, to support a discussion around that to ensure that you are feeling like you are not ending up in a liable situation. Renee.
Yeah, just quickly share that in our region, we put some language on our on our interest form for coordinated enrollment, noting that we are not recommending or endorsing any of these programs. We attached quality information, and then we also created a Zoom training and invite families to participate in that so that they can understand what quality looks like. And now we'll be adding this new portal feature so that families really feel empowered to make that decision. So that's how we've handled it. And exactly, Margie, it's because of the CCR in our background that that was on my radar for sure.
Thank you, Renee. And that is, I'm glad you brought up the statement because that statement is on every referral too. So that may be something else to share with everyone. Carrie, I don't know if you would be able to maybe even just drop that statement in the chat, or Renee, either one. I think it would be great. But I do think there's that, the bottom line is the empowerment and ensuring they're getting that information on quality and that they understand that they are making the choice. Even if it's one, they are making the choice. Carrie, were you going to say something?
Oh, I was just gonna say that whenever we are speaking verbally with a family, we always at the end of the call make sure to say, well, we try to say it a few times actually, just because it takes that's a lot to listen to all the things that we are saying to a family on the phone. But one of the things we always make sure to say is these are referrals, not recommendations. We talk about the safety portal. And we give the phone number for the Office of Child Care and let families know that they can use that information on the safety portal and calling the Office of, or sorry, I keep calling it the Office of Child Care, the licensing division, to get information about complaints and compliance history to help them in the process of making their choice. And then there is a statement that also goes out with all the emailed referrals and with text messages. And I'll put the exact statement in the chat, but I'm also happy to like meet with you and share some of those forms and things with you in case it's helpful language that you can add to your statements too.
Thank you, Carrie. And I see Danny has information in there too. Danny, you've also been in the CCR in our system, so you remember as well. So, are there any other questions and any suggestions for follow-up on this conversation? Because this is something I'm really, really passionate about, and I'm more than happy to help with. Michelle.
Just curious, since there are two different portals or ways for families to learn about childcare options, either through reaching out to 211 and all the different ways and getting referral versus the Find Childcare website, is there a stance or a recommendation from folks on the call of where we send families to? Because I think I historically have always sent families to 211, but I just want to ask that in case there are different perspectives. And I know Carrie's here, but Hannah left. So just an open question.
I can go ahead and respond to that now. And then of course, Carrie, you can jump on. Michelle, 211 uses Find Childcare Oregon. So they're using the same database. So you can go either way. They could call, if they call 211, they're going to get more of what we call an enhanced referral, meaning they will be asked questions about other things they may need in very kind and supportive ways. The team really goes through a lot of training around listening and around asking questions. And then what they can do is, if it does sound like they might need housing or they might need, healthcare or something like that, then Carrie's team will reach into the 211 database and send information about that. If they want to just go online and search on their own, they can. They're using the same database. So it's however the parent wants to do it. If they just want to do I'm going to go online myself, enter my information and get the list of childcare programs, they'll get pretty much the same list that the 211 team would give them in a call. It's just that if they have other like enhanced needs, they would get that. So,
and then I would just add to it that some people struggle with that online search tool through Find Childcare Oregon, and we get calls a lot where people go on there, but then they don't get any results for their area sometimes. And so I guess like I would say, if you give them the website, just make sure they understand that they should definitely reach out to us if they can't get a list out of it for some reason, because we do hear that sometimes people can't do it on their own.
Carrie, for those that speak different languages, other languages than English, so how does that thing work? And is there any waiting time for if somebody speaks Kanjobal or Somali, is there some waiting time, or people actually have to make an appointment with one of your specialists so that they can be an interpreter? How does it look like?
So on the childcare line, we currently have Spanish speaking staff members. We've got English and Spanish on the childcare line specifically. So for childcare calls, if someone calls in another language other than Spanish or English, we're going to immediately reach out to an interpreter for those other language calls. But we don't have to schedule an appointment at all. That's why we contract with 3 different language lines, because we want to immediately connect to an interpreter line quickly and not have to make people wait. We want to help them as they're calling in. That being said, sometimes calls go to voicemail, or there's like a wait time where people have to wait on hold until we have somebody available to answer the call. So
Danny.
Danny has her hand up, yeah.
Yeah, I just wanted to share, I don't know how many of my fellow hub directors have used the portal before. I'm really excited about hearing about these updates because that's going to be so great. And truly, the portal has only existed for a handful of years anyway. Before that, everything was on paper records and much harder for families to find. And so I would be very excited for us to share this, and the ability, like calling 211 is great, and not all families are super interested in calling anyone. As a person who doesn't super love to be on the phone, I don't want to do that either. So I think that if we as hubs can also, encourage families to be accessing that in the way that feels best for them, doing our own sort of marketing for Find Childcare Oregon, that's going to be a lot more helpful for families. I would love to have materials from Delk though to do that marketing. So whenever that comes, I just wanted to say that I would like us to be involved.
Thank you, Danny. There is also a comment in the chat from Abby. I wonder if any of the training for 211 staff would be helpful for our coordinated enrollment specialists / enhance their professionalism. I'm new, so I don't know if that's been offered.
Abby, that's a great question. Thank you. TRI does that training for 211 staff, and of course 211 also does training for their childcare staff, but the whole referral process, TRI does that training. So I'd like to check with Hannah to see if that's a possibility. I do think it would be great to have as many tools and resources for the coordinated enrollment staff to have to support families, in ensuring that as much information and education, we call it consumer education and information for quality childcare. They have that at hand and are able to, kind of reinforce the opportunities for parents to feel empowered in their choices. So I will go ahead and ask Hannah and see what we can do to support that.
There's a comment from Jillian. When I Googled FCCO, the Feral Cat Coalition of Oregon came up with the acronym of FCCO. Sometimes acronyms can be confusing to families. I think that is a good flag. Thank you, Jillian. All right, with that, I'm going to move us right along to Gabby, who has a presentation for Raise Up Oregon. Gabby.
Hey, Maria, thank you. And hey, everyone. Just want to clarify, I don't think it's much of a presentation because I think we've talked to you all quite a bit about Raise Up Oregon, but really kind of just wanted to share this deck with you all for you all to really share with your governance board or anybody else. And let me share my screen. And I apologize, I do have to jump off at 2, but I don't think that I will take that long, and happy to answer any questions offline as well. But just wanted to walk you all through, sorry, I accidentally muted myself. So it's a relatively short deck. I think it's about 10 or 11 slides. It starts off with just an overview of what Raise Up Oregon is, just some emphasis on the importance of an early childhood system plan, as well as just some information that's included in the plan on how many children are in Oregon, and the importance of how the importance of the early years are to and the positive impacts that there is across their lifetime. This slide also kind of just focuses on the importance of a system plan, and it showcases all 6 agencies who had input into the development and creation of the plan, as well as the implementation that's currently ongoing. This slide kind of just talks about the vision and the goals, and you'll see the famous petal in each petal, and again for each of the agencies that had a say in the development of the plan. And then the next couple slides kind of just go into each goal and the objectives that fall within that. The council principles, a slide on the development and some of the outreach that occurred, and then a question for slides. The one thing that I did want to flag, and this is kind of just a flag on behalf of me and Build, is that if there's an ask for any other specific slides, so if you're talking to your governance council and really want something pulled, say for like OHA or behavioral health, let me know, and happy to kind of dig into that and create some additional or supplemental slides that you all can include in that as well. I will also be sharing with Maria once I get some translations back. We have a 1-pager for families that I don't think I've shared with you all. So want to share that as well, just so that we can kind of get the word out to families as well. And it's a 1-pager, pretty easily digestible. Let me pull it up really quick, but I am in the process of getting it translated in multiple languages for you all as well. But just wanted to put that on everybody's radar as well. It showed up in a different screen. But here is the 1-pager, and it really kind of just talks about, makes it kind of easy for families to know what the state is doing to support children and childcare providers, and it just provides, I think, a more digestible reading material for folks. And I don't think that there's any questions for me, but let me know if there's any questions. Otherwise, I think, Maria, you have these slides, and I'll send out the 1-pager as soon as I get the translations. I'm happy to share the English one. And then if folks want to just wait for the translations to come in, there should be in, I think, next week, but happy to do whatever works best.
Yeah, thank you, Gabby, for the quick pivot, and we appreciate it. And I will definitely include this in my recap email. And as soon as we have the translations, we will get those out to you as well. Up next, we have Dorothy with some ERDC updates. Dorothy.
Hi, everyone. So good to see so many familiar faces. Maria asked, she's not going to be until later in the agenda. Come then. I was like, of course not. I will 100% come and turn my camera off and look at everybody that I know. All right, let me share my screen. And apologies, I'm recovering from a cold because 'tis the season, especially if you have young kids. Share. That's not what I want. Present. Okay, so I'm just going to provide some ERDC updates for you all. The first thing I wanted to note was come January, as of January 1st, this past year, we had a couple of changes. We have new ERDC maximum rates for providers. Both of these kind of relate to providers. They're available on the DELC website, as well as providers have a provider guide insert that was mailed out to them, as well as available online. The other change that happened January 1st was related to legislation that was passed that we had to implement for an additional payment. So ERDC will pay an additional 9% for an ERDC payment that is processed late. Late means for a home-based provider, it's a payment's late when it's legible and completed billing form is processed more than 4 days after it was received, and for center-based, it's 7 days. And there is an online form that can be completed if a provider believes that they received their ERDC payment late. If a provider doesn't feel comfortable filling out the online form, they can also contact the direct pay unit for assistance directly. And as you all know, ERDC does have a wait list that started after November 3rd. Anyone who applied after 11:59 on the 3rd could be screened for ERDC eligibility as usual prior to that, and then after that is subject to the wait list. Some families bypass the wait list. The current budget means that there is not sufficient funding to serve enrolled families for the full biennium. And part of a legislative ask going into the short session is for additional funding for $99 million is what we've been approved to ask for the legislature. Currently, our caseload for January is at 16,274 families. That's our total caseload. It is a little bit more families for our total caseload from last month, but our growth is slowing given the wait list. When we look at our total caseload, we break out those numbers between those families who are approved for ERDC and connected to a provider, and those that are approved for ERDC and not yet connected to a provider. So out of that 16,000 and some families, 12,000 of them, just over 12,000 of them are connected to a provider. That was an increase from the previous month. We've seen a decrease in the number of families who are approved for ERDC and not yet connected to a provider. So our active caseload, those that are connected to a provider and are the ones that essentially are what we're paying out from the ERDC budget, that is slightly increasing, but has slowed significantly given the wait list. Wanted to just remind folks, if you probably received an email about this, but if you haven't seen it already, there is an ERDC dashboard available on the DELC website. It includes both the state level data that I just showed you tracked by month, as well as some county level data. We are working to get some waitlist data up shortly. We were hoping to have it up last month and had to do a little bit more data cleaning than initially anticipated. So please keep your eye out for waitlist data so that you will have that information in terms of the size of the waitlist. Our goal would be to have a total number, so total waitlist number, as well as some county level data for the waitlist as well. And then just wanted to share about some ERDC communications coming up that you may see or hear about. So there's an ERDC email update. The first one went out, I think, at noon today in English and Spanish. Those are going to be quarterly updates about the ERDC program, unless there is some sensitive update, some time sensitive update that has to be provided kind of in between the quarters, but that's right now our goal is to have that out quarterly. The audience there is pretty broad. It's for partners, families can sign up if they're interested, providers. It's a pretty broad audience. In addition to that communication, through the One eligibility system, we have the ability to text families that are on the wait list. So we have initiated our first quarterly text nudge. It's called a text nudge. That's sent to those on the wait list. That will go out tomorrow. I've included in these slides, and Maria will share these slides with you all so you can read them after this meeting. But I've included here the content of this very first text nudge. The next one will go out in April, and we're looking to include information in that text nudge that will help direct any families that are on the wait list with preschool age children towards some other publicly funded preschool enrollment options, knowing that April is around the time of year that many preschool enrollment opportunities begin to happen. And then the third bullet down here, I just wanted to make sure folks were aware of. We'll be doing our website updates to reflect the new ERDC income limits in response to the updated FPLs for 2024. That will happen March 1st. Income limits for ERDC are in our rule set for ERDC, and any update to those rules has to be approved by the Early Learning Council. So we presented to the Early Learning Council in January. I'll come back this month to ask for their approval of those rule updates so that the new income limits can be effective March 1st. And that's it for my slides. I'll stop sharing that so I can look at your questions. No questions. Just
Of course. Nice to see you, Dorothy.
I'll turn the camera on, Begonia.
No. I only have one question. Those 4,000 children that are not being served, do you have data about from what counties? Something that we can look at?
So the unconnected, yeah. So if you go, that's a great question, Begonia. And do you know that I am happy to show you where you can find that information? So if you go to the dashboard that's on the DELC website, it looks like this, and you go to county level data, you find your county. Where are you, Washington County? You can see the percentage of unconnected families. You can do some data there to find the number that are unconnected. That'll give you a approximate number of how many families are connected versus not connected to a provider within your county. If you're looking for more specific child level or family level information, we should connect offline about that, because I'll just need to check with our folks around like ability.
Okay. Thank you. I was just wondering if there's something that tells us it's infant and toddler versus like after school, you know, like the different type of SLODO service that we provide.
Yeah, we don't have a report that's easily digestible with that level of information on that population. That being said, like we have access to reports that have a lot of different information, whether or not it's that level of specificity, and how long it would take to crunch that is a question. Good question. Always with the questions. You always have good questions, Begonia.
Any other questions for Dorothy?
This is Evan. I have a follow-up question. I guess, Dorothy, if we had the resources and we could crunch the data, what's the process for requesting it?
Wonderful. I think that if you want to share with Maria and I the specific request, we can put it through to our data and analytics team that have a data request process that we can forward to them for you all. I've done that before for other requests from partners.
Any other questions? Great. All right. Thank you so much, Dorothy, and thank you for the pivot as well. Next, we have Carla with some updates, and go ahead, Carla.
Hello, everybody. I'm going to sound like a broken record. I'm also getting over an illness, so I do apologize if my voice cuts in and out a little bit. Give me 1 second to share my screen. Let's take a look here. Can you see that?
No.
No. Okay, let's see. What about now?
Yes.
Except it's not sharing the right one. Okay, give me 1 second. I'm not the best person when it comes to this. Okay, let's try again. Well, anyways, while I pull this up, I am here to be very dry and boring and give you what you really want to hear, and it's all fiscal updates and just some reminders. let's see. There we go. Can you see that now? Maybe. Yay.
Good.
All right. So for those of you that don't know me, my name is Carla Branson. I am the fiscal grant manager for hubs and coordinated enrollment. And let's see here. I wanted to talk to you about, it is really not working for me today now, are you? Are my slides moving for you? They're not moving for me. There we go.
Yes.
All right.
You're good
Maybe.
now.
I'm telling you, it's all that Dayquil. So I want to talk to you guys about a couple things that have been brought up to me. First of all is a question that's come up about the carryover funds. So yes, we are still planning on carrying over any funds that were not used for that final quarter of your hubs agreement for state funding sources. So that's going to be your hub coordination, your KPI, and your stable healthy attached. So after you submitted those final quarter claims, any funds that were remaining for those three categories will move over to your 23-25 agreement. It will take me a little bit of time to get that all figured out. We will need to, of course, like in the past, do a new amendment in order to get those funds locked in. And because of all the stuff happening right now with the birth to 5 literacy and the possibility of having an amendment already for those funds, we're going to just go ahead and lump them together. So I'm anticipating an amendment with those 3 funding sources in mid to late spring. It just depends on how everything happens with the birth to 5 literacy process, but we will have those moved over. So I just wanted to make sure, don't worry, I'll have those funds for you. It doesn't apply for Title 4B funds because those are federal and they were on a little bit of a different schedule. And I did want to clarify that the reason that we are able to do this and other grant programs might not be able to do this is because the hub agreement has 1 quarter that lands technically in a new biennium. So because that final quarter of hub funding is technically within the 23-25 biennium, that small pot of funds from that last quarter can continue to move forward because we're not crossing that magical biennium line. So just want to let you know about that. And then, so the next thing are quarterly reports and claims. So we're in a brand new shiny Delk world. And I just wanted to make sure that we're starting this new agreement off on the right foot for everyone. And just to remind you guys that your quarterly reports and claims are due 60 days after the end of your reporting period. If for some reason you are unable to get that information to us by the 60-day mark, just let me know, let Maria know. Unless it's a really hard deadline due to like the end of federal funds or something weird like that, we're flexible. We're more than happy to work with you, making sure that we get, get what you need. I know things happen, but just make sure you communicate with us. That way I don't reach out and harass you. Or I'm not just sitting here waiting for the report. And I don't want to do either of those things. And then a reminder that if you do claim funds for a specific funding stream, please make sure to fill out your quantitative and your qualitative section in that tab for that funding stream. So make sure you scroll down and fill in any relevant sections underneath the dollar amounts that help us know what specifically you're doing in your region with the work. And I know that there's been a lot of changes, both with moving over to Delk and with staffing and me joining the team and Maria joining the team, and things, might have been done slightly differently with other people, but we're trying to just kind of streamline our processes, and knowing that all eyes are on Delk and all eyes are on hubs just in general with how early child care, early learning is going, we want to make sure that we have as much information easily accessible and available when it's asked for us, so we don't have to scramble and try to get that information. So that's why we're asking for these things in the quarterly reports. Now, that does include your coordination funds, and I will admit that one was a little weird, and I might have gone into misinformation, and I might have shared some misinformation to some people, but we do want to make sure that in your hub coordination tab, you are reporting your dollar amounts, and you are reporting, I think there's just a couple fields underneath on general system coordination. So we do want to make sure that you have those filled out for us as well. And so the next thing I have is that I will be sending out an information request, and I didn't want to stress anyone out unnecessarily. No one did anything, nothing's wrong. The request is going to all 16 hubs. I will be reaching out to everyone and asking for these things. I will be asking for a copy of your governance bylaws, if you have any conflict of interest policies, and if you have any type of written agreement between either your governance or the early learning hub and your fiscal backbone agency. I know not everyone might have that, but if you do have some sort of memorandum of understanding or responsibility or some sort of written agreement, if you could share that, that would be excellent. What I am doing is I am looking at some older ELD related processes that might be out of date. And as we're refreshing them for DELC, we're just making sure that we're all on the same page and that we have good processes in place to protect the hubs and governance and the fiscal backbones and make sure that we're just setting ourselves up in a place to be able to succeed. But I did want to just emphasize that no one did anything and nothing was wrong. I'm asking for this information from everybody. And then last but not least is just some reminders of some upcoming deliverable dates. So you get a whole extra day for your quarterly reports because it's a leap year. So you want to get them to us by the end of February, so February 29th. One of the hubs did let me know that when I sent out the expenditure report for the new biennium, the link wasn't working for them. I don't know if that was happening for everybody. So when Maria shares this out, I will have a live link for the place where you can now upload that Excel spreadsheet and just drop it in a smart sheet for me. That way, both Maria and I get instant access to it. And in case I'm out of the office, someone can cover for me and continue to approve claims if something happens and I can't be here for any extended period of time. Same thing for when Maria's counterpart joins us. That way they can cover for each other and we're not worried that anything's sitting in an inbox. And then the other deliverable that's upcoming is the MOU with the CCR&Rs. That's due on April 15th. And you want to submit that via email to Maria. And I think that is all I have. Like I said, it's all a bunch of dry stuff, but wanted to make sure I shared that with everyone. Are there any questions for me? Nope, sounds good. Thank you.
Great. Thank you, Carla. I know we have only 12 minutes left. I was going to do a Jamboard session, and I will continue to do that for whoever is able to stay, but I will also share the link so that we can make use of our time and you can continue to add it. I will keep it open, but it really was just for those meetings when we have a little bit more of open time. I really wanted to get insight from all of you of what are you looking to get from these meetings and how are you hoping the direction for it. So I would love if we could take some time either right now or just even in the coming days. I know Jamboard's going to be going away, so that is really unfortunate, but it is going to be live through the end of the month. And so as you have the moment, please I've added 3 sections. Let me see if I can share my screen with you all. And where did it go? Here we go. So if it's just, what have you found most beneficial from Hub meetings and would like to see continued? And then suggestions to enhance future meetings or something you would like to see added. And then maybe additional comments, something that maybe doesn't fit in either one of those sections, but something that you would just like to comment about it. I would really, really appreciate it. I think if we can, I really want this to feel like your space and something that feels like a good use of your time. So I really would love to know what is it that you guys do find helpful and want to see more of? What isn't so helpful and would like to see less of? So if you have a moment, I know we have 10 minutes left here, but if you have time even in the coming days, I will make sure to link it in our recap email as well. And please add to it so that I can help shape our meetings and make the most of our meetings together. Any questions there or anybody who's willing to come off of mute potentially and share anything that either they really enjoy or is not so helpful. And-
Maria, nobody
We don't have
can.
access to the Jamboard.
Oh, no one has access. Maria, it's in view only mode right now. Let me take a look and see why that is. Okay, let's see. I think I just updated, so let me know if that worked. I just was able to switch it.
Perfect. Thank you.
Yep, that fixed it.
Thank you. Anyone willing to come off mute or just say even like what is helpful to you all, or you don't have to. I know that's a lot of pressure to come off mute and do that, but even if you just in the coming days as you have a moment, please feel free to continue to add to the Jamboard. And I know while Jamboard is going to be going away, I will still have access to view it. So anything that you guys are willing to add, please know I really do take it seriously and I will really use it to shape our future meetings and bring whoever you guys find helpful. I know on one-on-ones, some people have said that they would be interested in hearing more of like a collaboration from other hubs and sharing those successes. Some people have asked for specific presenters within DELC or maybe externally. So any ideas that you can think of, I would really love to be able to implement that for you all. And I do see a question in the chat. Does anyone have a copy of their MOU with the CCR&R that you would be willing to share for inspiration? I know we're working, there is a hub who has identified themselves that would be potentially open to sharing theirs, but it has not been submitted. So as you guys look to turn them in, as you submit them, and if you are willing to share, I know that has been a request that we have gotten from quite a few hubs that they would love to see one for inspiration and just get a general idea. So we do not have an example at the moment. I don't know, Margie, Norma, have you guys gotten one? I know I have not, but no, I don't think so.
Maria, this is Danny. I'm waiting for a response from my CCR&R just to make sure that it's okay with them before I share ours. I don't want to do that without their permission, but I definitely will once we've got permission.
Thank you, Danny. Yes, I didn't want to call anyone out specifically, but thank you. Yes, Danny has identified that potentially they would be willing to share theirs. So as they do submit it, and if it is cleared, we will absolutely share that with clearance. So thank you for that. And thank you. I see some ideas and things in the Jamboard, so thank you for that. I really appreciate you guys taking the time, but I can certainly end the meeting now so that you guys can work on this. And I will again leave the link open and I will send it in my recap email. And thank you so much, everybody, for the time that you guys took to, it was a long and lots of information, but thank you for bearing with us. And if you have any questions, feel free to reach out and let me know. And I can stick around and I will stop the recording. But if anyone has any questions, feel free to let me know and I'll stick around for a little bit. Thanks, everyone.